Knock, knock, knock. Hi, my name's Taylor Grisham. I'll be your student nurse today. Can you please tell me your name and date of birth? Okay, thank you. I'm now going to go check with the provider's orders. So on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you've ever felt, what is your pain level? The patient does not have a need for pain medication. Do you have any allergies? Okay, great, thank you. I'm now providing privacy by closing the curtain. I'm now going to place my supplies on a clean surface. I have them right here. Let me back this up a little bit so you can see me better. Okay, they're right here. Here's my wound, by the way. Okay, so today I will be cleaning your dressing, and I would be discarding the old dressing and putting a new one on, if that's okay with you. This is just to make sure that the wound does not get infected or anything, so that you can heal, continue healing on the right track, if that's okay. Okay, great. So, do you have any questions for me? Okay, thank you. The patient does not have any questions. I just want to repeat that you are getting your dressing changed and putting a new one on. Okay, so I am now going to raise the bed to my hips. I'm going to perform hand hygiene. I don't have any Germ-X, but I am performing hand hygiene. I am preparing my supplies. I'm going to put on some sterile gloves. These are the sterile gloves, but okay. After doing this, I'm going to, here's my wound. I'm going to check the wound and for the color, odor, and consistency and the amount of discharge, if there is any. And I have already removed the dressing and thrown it away into the right receptacle. So I can tell that the wound does not have any type of odor. The color is a little bit red around the area. There's some slight bleeding still. The consistency is pretty red throughout because it is a wound. I see no signs of discharge. Okay, so there is no discharge. I am now going to assess and measure for a scar. If there was any eschar, I'm saying if there was any eschar, I would be measuring. Okay, you can't even see. I don't know how to do it. I would be measuring with this for the eschar, and I would also be assessing for any eschar. I'm now going to check for tunneling with my sterile Q-tip. There is some tunneling. Now I will measure the wound dimensions. So I would say that it is about 12 centimeters long, about 2.5 centimeters width, and probably about 1.5 centimeters deep. Alright, I'm now going to throw this away in the receptacle, like in a trash can. Okay, I am now going to remove and discard my gloves in the trash can. Alright, just threw them away. I'm now going to perform some hand hygiene. Okay, now I will be putting on my PPE, which is a mask or protective eyewear. I don't have any protective eyewear, but if I did, I would be putting it on, and if I had a mask close near me. I don't really want to waste the mask in there in case we end up going back to campus. So I'm so sorry about that. I would be putting on a mask, and I would be putting either on a face shield or safety goggles. I am now going to open up the sterile package. Here's my wound. I'm going to move over there. I'm now going to open up the sterile package and begin setting up my sterile field. This would be on the inside, but just none of this fits anymore in here. Oh, wait. I don't know what to do with my wound. Okay. Does this make it better? I can't even like see. I'm so sorry. I'm still trying to figure out what is the best way to record. Okay, so I am now going to put on some sterile gloves. I don't have enough room, and this is a weird desk. I don't think I put these back normal in the right way. Okay. Okay. Putting my wound back over here. My hands are sterile, sorry, I just don't have enough room. Now that I have my sterile my sterile gloves on, I am going to proceed to grab out of my sterile container some saline solution and a, what is this called? And a syringe, yes, okay. I would also be grabbing 3 to 4 gauze pads. Okay. This would be inside of this, but I'm sorry. Now that I have it like this, I would be putting in, I don't want to get it everywhere, but I would drop 35 to 60 milliliters of saline solution, and I would be doing this movement and continuing to put saline solution on the wound until the discharge or the drainage was clear. Okay, after this, I will pat the wound dry, making sure that I do not use the same gauze twice. Okay, great. Okay, now that I have them like that, I am going to throw those away in the right receptacle. I will now begin packing the wound with a sterile Q-tip that is inside of my wound. My sterile package. Okay, I will now be grabbing this and I'm going to open this up. And I will begin packing. Oh, and I just broke it. Seems like this wound only took one, probably because it's not too deep. But if it was a deep wound, I would continue packing it until it was all covered up. Alright, since I broke this, I'm going to throw that away into the right receptacle. I'm now going to apply a dry gauze pad over the top. I'm reaching into my sterile package. I would tape this closed, or I would tape this off. This is very sticky. Okay, this wound is not going to work for me taping it, but I would tape it on all sides, and then I would proceed to put my name and the date that it was changed on the dry gauze on top. After doing this, I would also put the time on there as well. I'm going to remove my gloves and discard of them into the trash can or wherever is acceptable. And if I was going to not use these again, I would take them off the correct way, but I am using them again. Sorry. Okay, I'm now going to perform hand hygiene. So on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you ever felt, what is your pain level? Okay, great. The patient still has no pain. I am now going to put the side rails up. I'm going to perform hand hygiene again. I'm going to put the bed in the lowest position. I'm going to lock the bed into place. I'm going to put the call light closest to them, and I'm going to perform hand hygiene one last time. All right, thank you for allowing me to change your wound and assess your wound again. Thank you.